when you get to see new patients, right, coming to see you, what is the most common, I guess, form of CKD? Because there are different types of kidney disease, right? As we know it. And so what's the most common type that you see?
Sure. So to that point, I mean, there are a number of causes of chronic kidney disease. And the reality is none of our kidneys are perfect. Right? And I say this to everybody, technically just looking at the staging itself, stage 1, stage 2, stage 3, stage 4, stage 5, effectively stage 1 and stage 2, most cases are considered normal. And I put that in quotation marks. But in the end, no matter who I'm seeing, and whether you're a mild numbers or advanced, it's about looking at the risk factors for kidney disease. And, like I say, it's probably not just one thing, but it could be multiple things. And there's usually not one cause. So the most common is diabetes, diabetic kidney disease, diabetic nephropathy. There are several different names for it. So that's certainly very common in our country. And the reality is it's probably rising in incidence, and whether we have the numbers or we know about it, and it's a silent disease, and both the diabetes part of it, but also the kidney disease part of it as well. And I would say a close number 2, and a lot of them, like a lot of the folks I see have both of these, is blood pressure. So high blood pressure certainly is a hypertensive nephropathy, hypertensive arteriosclerosis, whatever you want to call it. These are all within the subgroup of common causes of chronic kidney disease. So most of the folks I see have some form of diabetes, high blood pressure, and just that goes along with what we call as metabolic disease. So certainly obesity, weight control is very important for kidney health and your heart health. And a lot of the medicines and things that are out there, you may see commercials, and we'll probably end up talking about some of them here, that are for the kidneys are actually heart medications. And what I tell folks, heart and kidneys are like best friends. So, in the middle of this, you have diabetes, you have blood pressure, and if one gets upset, the other one's going to get upset too. And that's where we see a lot of folks, especially in the hospital, the numbers are going up and down. The kidney numbers, I should say, are going up and down. And so that's where a lot of folks we see have to have good diabetes control, good blood pressure control, just regular good old primary care, standard of care. And then a lot of them may need cardiologist or something like that to kind of keep an eye on their heart function and all of that.